I'm Dr. Theodore Belfour. I'm a senior certified instructor for the International Association of Orthodontics. I'm a fellow in the Pierre Fauchard Academy, and I've been be inducted into as a fellow in the International Academy of Dental-Facial Aesthetics next month at the Harmony Club in New York. So, ladies and gentlemen, you folks in your careers have become really well-versed and experts in teeth and gums. Some of you moved on and have a lot of knowledge about the jaw joint. But in the last roughly 15 years, what I've done is I've looked into the cranial bones and the cranial sutures, which is mainly the province of the osteopath. Unfortunately, in our profession, we don't integrate often with the osteopath. You ask the average dentist what the osteopath does, and they're a little confused because osteopathy, and a lot of dentists have tried to get involved, has a lot to do with understanding the movement of the cranial bones, but you have to feel them. And that's very, very, very difficult. However, if you really understand your anatomy, you can understand a tremendous amount about your patient, about their cranial system, about their craniosacral system, by just looking at your patient. That's how we're going to start this. And in tomorrow's session, I'm going to grab a bunch of you and I'll start to talk to you by looking at you and by doing a little bit of muscle testing. And based on that, we can explain how you can improve your breathing. So, dentistry is top-down treatment. Our friend JP, he's more expert in bottom-up treatment. But the overview is, it's one system. And the fact that you work in this space, you miss a whole program because they don't teach it to you. They don't teach you the importance of how the head sits on the cervical spine, for example. So when I look around the room and I see folks with their head tilted like this, they have no idea what they're doing to their breathing. And by the way, you as dentists, the way you practice, you really are not aware of what you're doing to your breathing. Some of you have already listened to some of my program, understand a little bit about it. But as a dentist, it really behooves you to go back and look at your anatomy, okay? So, to get started, nature designed us. So everything above here, above our neck, is supposed to be symmetrical. You've got two eyes, two ears, two nostrils. Everything, we have parallel paired bones. Nature designed us to be symmetrical. How do we get to be symmetrical? Proper breathing, proper swallowing, and proper chewing, which is, in effect, craniofacial development. So, if you just look at somebody and you see that they have facial asymmetry, you know that they have a lack of craniofacial development. What you're not aware of, but hopefully will change your life by the end of this session with Tim and I, how significant that is to breathing. You are the master of this, the mandible. And by the way, the base of the tongue and the mandible are one thing only. They're one thing. They work together. And what you have to remember, there's always a left side and a right side. In other words, we have a right geniohyoid and mylohyoid, a left geniohyoid and mylohyoid, and basically they're attached to the mandible. That's the mandible. And the mandible is the first step, the key to your posture. So you have to be thinking, if that mandible is misaligned, that patient cannot have proper head posture. You have to be thinking, if there's not enough room for the tongue in your patient, that patient cannot have proper head posture. And by the way, if you don't have proper head posture, you cannot breathe correctly. It's all linked together. The missing link is the ability for the dentist, and the dentist can do it better than anybody. The dentist is the key to improving head posture, because we are the kings and queens of the mandible. Wherever your mandible goes, it affects your head posture. Once that mandible affects your head posture, it affects your jaw joint. It affects your occlusion, which affects your hyoid, which affects your tongue, which affects your breathing. Do we get it? We have a responsibility to understand the position of the mandible. Do we as dentists do that currently today? A big resounding no. What is orthodontic treatment today? Unfortunately, when you look at a patient's mouth, you're going to see a dental arch. Oh, look at that. It's flat on the right side. I would like to have a nice wide smile, doc, so the dentist complies and we get a nice, beautiful dental arch. And by the way, we got to line that mandible up, right? So we're going to take the center line of the lower and line it up with the center line of the upper. Well, guess what, folks? That maxilla can be to the left. The maxilla can be to the right. The maxilla can have a cant. You cannot put straight teeth into a crooked face, and yet the profession does not recognize it. So how did I get involved? Accidentally. What did I discover? Well, I can't help it. We have an entire profession with FDA appliances, and every single one of those appliances, when you bring your teeth together, you hit on both sides. Well, hello, if I give you a stick of gum, anyone on the entire planet, there is nobody that chews on two sides at the same time. I'm sorry. That's not the way the body works. So many, many years ago, I discovered a unilateral bite block can create change. And the more I learn, the more we understand how important chewing is. And what is chewing anyway? It's cyclical, alternating pressure. Chew one side, chew the other side, chew the other side. Guess what? That's how the body works. The entire body works like that. Everything is moving. When we breathe, the cranial bones move, the ilium, everything is moving. Your entire body subtly is moving, and when you move yourself physically, your jaw is shifting from one side to the other. Buccal cusps of the lower are hitting buccal cusps of the upper on one side, then buccal cusps of the lower are hitting buccal cusps on the other side, signaling the body. The body has its own communication system. And it's cyclical, alternating pressure. What is breathing? Reciprocal, cyclical, alternating pressure. What is swallowing? Swallowing is a pressure volume change. How does our body function? By breathing, we change the pressure in the spaces all over our body. And if you're posturally incorrect, the air's going here, it's not going here, it affects your entire body. It's posture, posture, posture from the cranial system down. And then, of course, you work interdisciplinary, if need be, with someone that works from the system up. We need balanced equilibrium. Why? One of the doctors asked me, who's your patient? That's a great question. The patients we're seeing today are patients that suffer from anxiety and stress. Well, in the 1930s, Hans Selye already defined chronic stress, and it lands today. There are 31 symptoms. We're treating patients with chronic stress. They got more symptoms than you can throw a stick at. That's who we're treating. So the patient that comes in with an airway problem to see you today, that's not breathing properly, they're stressed out. So what are we doing ultimately to treat that patient? We are ultimately treating the autonomic nervous system. Our goal is to improve autonomic nervous system balance and coherence. We want to reduce that stress on the body. Furthermore, well, that's getting into my next lecture. Let's just take a quick look to make it simple. How you look at a patient, it's really the beginning of it all. Remember, symmetry from the neck up. So for me, I showed people their facial changes and everything, and way back, nobody believed me. They had Photoshop, and everybody was, oh, Photoshop, yeah. But now we have cone beam technology. We have 3D cone beam, DICOM data, scientific data. And by the way, thanks to the Mayo Clinic, we have the most advanced software on the planet. They've been developing it for 36 years. 36 years. About 10, 12 years ago, I met 4 programmers that had already been working on it their entire career. I met them at the Mayo Clinic. 36 years to develop this software. What can we do with it? We can look at our patients before and after treatment for the first time, and we really know what we're doing. When you put an appliance in somebody's mouth, your assumption is, I'm helping them. Well, early on, the first thing I discovered was that I compared a unilateral bite block appliance, lower appliance, to a Gelb appliance, where when you bit down, you hit on both sides. And the way I looked at it was not with the cone beam, I looked at it with heart rate variability. You folks know, heart rate variability is a non-invasive way to look at the autonomic nervous system. I won't go into it, I assume you guys have some knowledge about that. Well, they have little meters today. I do a little WatchPat, not WatchPat, M-Wave. I do the M-Wave 2. You hook it up on the patient's ear, you put it in the computer, and basically it looks at the heart rate variability. The thing you need to know, just as a refresher, when we breathe in, our heart rate speeds up. That's actually stress. This is inhale. This is exhale. And we slow down. That variability is a better way to judge the health of our circulatory system than a blood pressure cuff. So I put a Gelb appliance in the patient. First I test them, sitting there or standing naturally. And then I put an appliance in there and I have them bite down, close their eyes, and breathe through their nose. And I watch their heart rate variability. Well, when you bite down and you hit on both sides, that compressive force, your autonomic system goes like this. However, if you put an appliance in and you bite down and you create strain on the cranial system, the same way we chew. Without our hard force of chewing, we don't even develop our neurologic system. Chewing is that important to the body. So I put an appliance in with a unilateral block, they bite down on it, and I watch the autonomic nervous system go into green like this. The body loves it. The body loves when you chew something firm. So I lived on the Upper East Side of Manhattan. I used to see the mothers with a big smile on their face take their children for smoothies. It's so healthy. We're doing such a wonderful thing for our children. But they don't have to chew. God forbid they should chew. So the key secret to this appliance that makes it different from all the other appliances out there is the unilateral bite block technology. So before you're done, you're going to know 4 reasons why the block goes on this side versus this side. In other words, where do you put it? Right? So you will know that for sure. So I use cone beam today because with cone beam I can look at the sagittal, the coronal, the axial view in multiple slices. And why do I do that initially? Because, unfortunately, ladies and gentlemen, let's be realistic. The only thing you are ever taught is to treat the symptoms. What does a CPAP do? It treats a symptom. What does mandibular advancement, which is only one at night, by the way, what does that do? It treats a symptom. It's not treating the cause of the problem. So I developed an evaluation system to look at the cause of the problem. It's not that hard. Once you begin to understand what the correct anatomy is. Well, how do I know that? Well, I base it on research that was done in Australia by Tony Ansell, may he rest in peace, and David Reynolds. I learned that research 15 years ago. What they did, they took footballers, the healthiest guys. They looked at a lot of them, and they did the cranial measurements. They looked at the cranial base length, and then they looked how the face developed in relation to the cranial base length. Why? Why? Because that's how we grow. In the womb, we got the cranium, the brain, the basic cranium, and the face grows off the cranial base. The maxilla grows off the anterior cranial fossa, which is significant. And the mandible and the airway grow off the medial cranial fossa. So they are related to the cranial base. And guess what? The ideal development is a 1-to-1-to-1-to-1-to-1 relationship. What am I talking about? Cranial base length, face width, face height, jaw length, distance between the mastoid process are a 1-to-1-to-1-to-1-to-1 relationship in ideal cranial development. So it's very easy to take a look with the software. And what do you see? Well, you see a short face or a long face, you see a short mandible or a long mandible. You look at the position of the maxilla, and you must understand the position of the maxilla if you're working in the mouth. It's just common sense. If your maxilla is tipped like this, you're going to wear the front teeth, aren't you? I mean, it's just so simple to be able to look and understand who your patient is before, during, or while you're treating them. And by the way, it takes about 5 seconds to look at a face and understand half of it right away. In relation to breathing, I'm really getting ahead of myself. Tim will never have any time to talk. We'll get to that. So let's go. Yeah. So I just came back from Stockholm, where I spoke with James Nestor and Anders Olsen. I don't know if those relaxators came, but tomorrow, one way or another, we're going to try to get you relaxators. What relaxators are the exercise program where you breathe in through your nose and out through your mouth, and we're going to try to explain the power of the exhale. What do we do to treat our patients? We use two systems which are infallible. We use the power of the exhale and the power of the sphenoid. Anybody here doesn't know what a sphenoid is?
They will.
They certainly will. When Tim gets through with you, my God. So Anders Olsen, attractive man, good-looking man. So how do I look at him to determine how do I treat him and what's his issues and does he have any issues, okay? So it's a familiar face. So I developed something called a chimera system. What you do is you take the face, you divide it in half, you take the left side of the face, rotate it on the y-axis, and that's the face you get. You take the face, divide it in half, you take the right side, rotate it on the y-axis, that's the face you get. Asymmetrical. Now, you're a bunch of sophisticated doctors in here, but if I ask you why does he have a face like that, I don't want to bother, but you're not going to give me the right answer. But the answer is so plain and obvious, it's ridiculous. Anybody understands this? This face is round. He's got initially a wider parietal and temporal bow on his left side. This face is round. This face has a wider cheekbone on the left side. Why? Does anybody know there's a maxillary sinus in here? Does anybody know there's a frontal sinus in here? There are hollow spaces there. Guess what, folks? We had something called gravity that puts 25 pounds per square inch on our body, which in effect, the average person sitting here is about 3,000 square inches. That's 20 tons of pressure sitting here so you don't fly off into space. Do you think that affects your development? A little bit. So he breathed well. What happened? He breathed well in his left side. I've got nothing. Oh, there it is. So he breathed well into his left side. He breathed well and he resisted the force of gravity. So he developed really nicely on the left side. What I just pointed out, parietal, temporal, zygomatic, growing nicely. On the other side, he didn't breathe well into there. The force of gravity put pressure on the right side, so the right side of his face became tall and narrow. Is there anything hard to understand about that? And why is it important? Because it affects the position of the mandible. So, this gentleman did not have orthodontic treatment, and as a result, what do you think that did to the maxilla, by the way? He breathed into his left side. This is rotated up and out nicely. This is out nicely. What do you think it did to his maxilla? His maxilla is up on the left side, folks, and nobody ever taught you that. Nobody ever taught you that his temporal bone, which is the key to everything that we're going to be talking to you about, the sphenoid, the temporal bone, and the occiput. If you don't know everything on the planet about those, then you cannot do what we're doing here. And by the way, if you think that this teaching program just gives you another tool and you're just going to throw it in people's mouths, you don't belong here. You're going to have to study, remember, learn, look at your patients, see how different they are, see what you can do for them. So, he has a postural problem. His maxilla is high on the left side, his mandible is shifted to the left. What did we just say? If the mandible shifts to the left, it changes the position of the head on the cervical spine, which affects the jaw joint, the occlusion, the hyoid, the tongue, and how they breathe. So when I look at a patient, not only do I look at their face, and by the way, you can also look at the ears, that's another story, but I also look at their shoulders. How do we breathe? We have secondary muscles also. Unfortunately, dentists are trained to use not their primary breathing muscles, but only their secondary breathing muscles. Secondary breathing muscles lift the chest to breathe. We're working like this. Can we use abdominal breathing? This is abdominal breathing. Nothing moves here. That's correct breathing. Can you possibly do that when you're leaning over your patient trying to do some work in their mouth? Research shows you're busy preparing a crown. What do? Most of us hold our breath. We can't breathe properly. So you have to be aware of that. And basically, you have to be aware of that enough so that you prevent yourself from having problems. So there are exercises we're going to show for you so that you can help yourself and prevent a lot of what is typically going to happen practicing dentistry. You went to dental school. You paid them a ton of money. They never once told you about the occupational hazards of doing dentistry. This group together can bring a class action suit against the dental profession. Some of the problems that you will have doing dentistry later on in your life, some of you are serious, but nobody ever told you that. You know, we'll get into it. So anyway, he's asymmetric. And as I pointed out, he didn't breathe well into the right side of his face. Guess what? This is all you need to know. There are 10 different cranial strains, but they can get confusing. So we want to keep it simple, because to practice dentistry correctly, the only thing we need to know is how to align the mandible correctly. Does that make sense? And all of us in here know that the mandible is the victim of the maxilla. So what am I saying? I am saying that I can change the position of the cranial bones to realign the mandible, but it's not me doing it. It's the body. Every physiologic functioning system on the planet has the ability to self-correct. If you send a correct signaling to the body, the cranial bones will reposition, and boy, can I show you that. We're going to do that tomorrow. The cranial bones will reposition, and how does that work? What determines the position of the mandible? The dentist thinks the dentist does, but that's stupidity. What determines the position of the mandible is the temporal bones. If you have an external rotation, let's say an external rotation on the right side, which is actually a forward rotation of the temporal bone, which brings the condyle back on that side. And how do you know? Look at your patient. Do you know how important that temporal bone is besides your ears? Hey, this is external rotation, by the way. I'm internal rotation. But anyway, that's where the petrous portion of the temporal bone, between the external auditory meatus and the mastoid process, that's where your ear is attached, but that's where your inner ear, your vestibular system is. So what am I saying? I'm repositioning the cranial bones, allowing the vestibular system to work better, and guess what? I could be more posturally correct. If you got one ear higher than the other and one eye higher than the other, your sensory system is compromised. Your brain takes the information from your vision, from your vestibula, to determine how your body is positioned. And the dentist is the only one, the ultimate person, who is capable of improving all this, which I can go so far to say is we're the only ones who effectively can treat C1, C2 instability. That's a big deal. That's where you take it to. Okay? Oh, so what I wanted to show you, so here's what we're looking at. It's very simple. You take a facial photo. This is our friend Anders. His left eye is higher, left corner of the mouth higher. This is one strain. Then there's the opposite. The right eye is higher, the right corner of the mouth is higher. This is more complicated. When you look at a patient, the distance between the corner of the eye on the left side and the corner of the mouth on the left side is small, and on the opposite side, tall. That's basically, this is left torsion. On this side here, you have the opposite. The space between here and here is small. Space between here and here is tall. All of those affect the position of the mandible. The goal is to neutralize cranial strain. If you want to learn about cranial strain in peer-reviewed published articles, you read Gavin James and Dennis Strokan. Gavin James and Dennis Strokan. They published all those, a dozen articles on cranial strain. My mentor, Dr. Jeremy Mao, who taught me about growing bone, who researched 15 years how to grow bone, they shut him up. They shut up Dennis Strokan. They shut him up. The profession doesn't want to hear this. So you folks, you are the pioneers. If you're willing to do this, and if you're willing to talk about it, you can change dentistry. Anyway, that's another story. All right. So here's how we determine it. I just took a photo, and by the way, one of the folks that I taught showed me the easiest trick. Use a PowerPoint, take a photo, and basically paste it into PowerPoint. Then use your cursor to drop the face down. You drop the face down so that you have just the eyes down here. And then if the eyes are not level, you can just level the eyes, all in PowerPoint. So then you bring that up, and once you have the eyes leveled, his eyes are perfectly level, then what you do, you look at the line from the corner of the eye to the corner of the eye, corner of the mouth to corner of the mouth, and you see his sphenoid, the sphenoid is the back of the orbit, is rotated to the right. How do I know? He's got a higher eyebrow, he's got a higher eye, his left ear is higher and more abducted. He is classic left torsion, and his mandible is to the left side. This is him. What do? We make the HomeoBlock appliance with the bite block on the right side. What we're always doing is leveling the sphenoid. The sphenoid is the central bone of the neurocranium. It's the key bone in the skull. It affects 7 other bones. No bone works independently, except maybe the mandible, but even that doesn't because it's attached to the sphenoid, for God's sakes. So here, we understand he's left torsion. His mandible is to the left. So swing your jaw to the left side. It's hard to keep your head in one place if you swing your jaw because we balance on a stick, our neck. Basically, if we swing to the left, our head position has to be supported by our neck. That affects how the head sits on the cervical spine. Now why is it important? Let's go back to who our patient is. Albert Einstein said it best. And also it defines us, between us and an athlete, a real athlete. Why aren't we sitting here because we're not getting paid multi-millions of dollars to play some kind of sport? I bet you Todd would rather be playing some kind of sport and getting millions of dollars.
That'd be nice.
It would be nice, wouldn't it? So you'd look at a tennis player, for God's sakes. As soon as that ball is about to hit the racket of his opponent, the brain has already computed where that ball is going to be and what position the body is going to be in to return that shot with the maximum of force. The brain can do that, but the brain needs proper information. And proper information means your cranial system has to be developed and symmetrical and functioning. So when you breathe, the cranial bones all move correctly. Your cerebrospinal fluid all moves correctly. Your pineal then generates melatonin so you can fall asleep. Just to link it to sleep and breathing slightly. But Einstein said it best. Most of us, unfortunately, we do not have balanced equilibrium. So what Einstein said, everything in the universe is governed by the same basic law and moves towards what? Balanced equilibrium. Why? For conservation of energy. Since none of us have balanced equilibrium, none of us have conservation energy. We're all working too hard this second to keep our body alive. Our heart rate is too fast. Our breathing is too fast. If we take that athlete, put him in Todd's position over there, he's sitting there, he's breathing a lot slower. His heart rate's going a lot slower. He's using a lot less energy to run his body. And the average patient you see who is so messed up, their heart rate and their breathing is so messed up, they're in chronic stress, as I talked about before. So by balancing the cranial system, we enhance the autonomic nervous system that runs all this. And you guys, you dentists, you have to begin right here, using abdominal breathing. You have to take time out between your patients. And you got to breathe with your abdomen like I need to now. That'll relax me. Up until now, I've been using all the wrong muscles. All right. So, where's his head? His head is shifted to the left side. His head is not on straight. Where's his shoulders? Now, this is a good one. I can do it without, do you have a tongue depressor somewhere? I'll just pick anybody, and we'll basically want to be my subject here, and Nora.
Anything for science.
Nora, we'll just pick anybody because the way to see, I like Nora because she's wearing something where I can see her shoulders. So turn towards me a bit, Nora. So we want to look at her shoulders. Now, the first thing I notice is your head is tilted to the right side. I also see that your shoulder is square, and your left shoulder, on the other hand, is rounded inward, all right? So what we see on this patient here, what we see on the patient is that she has shifted her head or tilted her head to the right side. So merely her body weight is on the right side. She's supporting her body weight mainly with the right side. What does that do? It frees up the left side for breathing. So now what she does is rotate her shoulder forward, and now she's breathing through the left side. Let me show you how you get your patient. Bite your teeth together, put your right arm out, put your right side. Now just resist me. What you do is you put your body weight, resist me, dear. Yeah, look how strong she is. That's my entire body weight. Now bite your teeth together, put your left arm out. Now resist me. She got absolutely nothing. However, if we can tell the brain it's okay to use the left side, because it's a habit, we can fix it. Bite right down. Now we're talking to the brain. We're telling the brain it's okay to use the left side. Put the left arm out, resist me, right? Watch. My whole body weight, all my strength, and I can do it with any one of you. So the point is this. We are capable of communicating to the body in such a way to improve posture and breathing in 1 second. 1 second. Do you think it's hard? I mean, I love, if I get a yoga instructor or a gym rat in the office, I say, you're a pushover, man. What do you mean? I work out all the time. You're a pushover. Let me show you. And I demonstrate that. And I say, you want to be stronger? I'll just make you a simple little daytime appliance. It's FDA cleared. 2019. It's called POD, Preventive Oral Device, daytime appliance. You put it in, it's got the bite block for on the left side here, in this case. And when the patient wears it, what happens? Well, first of all, they're telling the brain that they can line up correctly and be centered. That's number one. And by the way, you can take photos. If I took a photo initially of Nora, her head is like this. I give her the appliance, put it in, have her relax, breathe in and out through her nose a little bit, tell her to breathe with her abdomen, and I take another picture, and lo and behold, she's straight up and down, for God's sakes. Why? Because you folks were never taught that they are trigeminal fibers in the periodontal ligament. When you bring your teeth together, when you hit that block, when you bring your teeth together, that signal goes through the mesencephalic nucleus of the fifth nerve to the motor neurons, thence to the medulla, where it mixes with the information from the vestibular system. In other words, when you bring your teeth together, you're telling your brain where your head is. That's how simple it is. So the folks that have really bad forward head posture, they're clenching all the time or they'll fall on the face. They're telling the brain where their head is so they don't fall on their face. Not so hard to understand. Your posture is critical to how well your body can breathe. Do you folks know this at all? Are you folks aware that these bones move when you inhale and exhale? Do you know that when you inhale, the cranium gets shorter and wider, and when you exhale, taller and narrower? Whoops, sorry. Back. Inhale, shorter, exhale. See that? Inhale, exhale. Now we'll look at it a different way. Here's your sphenoid. This is where your eyes sit. Your eyes sit. This is the greater wing of the sphenoid, greater wing of the sphenoid. What happens when you inhale and exhale? When you inhale, you get shorter and wider. So watch what happens here. Shorter and wider, taller and narrower. The cranial bones move. Now to take it, this is a bit of an exaggeration, but to take it here, what are we looking at? This is the key that they never bothered to teach you, because the position of these bones determine class 2 occlusion versus class 3 occlusion, for example. Did anybody ever teach you that the sphenobasal synchrondosis determines class 2 versus class 3 occlusion? Damn! So this is the occiput. Here's foramen magnum. Here's the sphenoid, and here's the ethmoid. When we breathe in, here they are. The cranium gets shorter and narrow. The SBS rises. However, all of us in here, that relationship has been fixed by age 10 initially, and the movement of those bones comes from that fixed position. So that position can be fixed in the inhale position or the exhale position. You can even have either have a short round face, brachycephalic, a tall narrow face, dolicephalic, or you could be mesocephalic. But that tells your occlusion. If you have the face where the SBS has an inhale, you class 2, hyperflexion. if you have a face where you're chronically, basically you're in hyperextension, you have class 3 occlusion. Why? Just look at the patient. You get the patient with the tall, narrow face, the ears are flat against the skull, the eyes, the interpupillary width is narrow, and they've got a strong jaw. They have class 3. You got the patient who's got a short face with the ears are flaring, the mandible is retruded. Class 2. So this is the way, oh, wonderful. Inhale, exhale. Now, why does that affect breathing? If you don't understand this, you miss the entire point. Because if you are in hyperflexion, this is where the head sits on the cervical spine. The attachment from here to the cervical spine is with ligaments like steel. So if this is in hyperflexion, this is forward, what is it doing? It pulls the cervical spine forward, and you have little room in the soft palate, behind the soft palate. You're a sleep apnea guy. However, if you got one of those tall, narrow faces with your ears are flat up against your skull and you got a strong jaw, you're fine up there. But guess what? You can have serious issues at the base of the tongue. But that's another story. So you need to know all of this. You cannot treat a patient blind. You can look at a patient initially already and begin to understand how that patient has to be treated. What you need to understand is proper movement of the cranial bones is essential for health. What about Anders? Handsome guy and all. His right face, the cranial system, the cranial bones were not moving the way they should. That means the cerebrospinal fluid is not stimulating the pituitary gland or the pineal gland correctly. However, if we grow the right side of the face, nature will develop the right side of the face with the homeoblock because it signals the body. We'll talk about that, Tim will. Once you do that, recent research shows with cyclical force on a cyclical strain on a single cranial suture can reach all the cranial sutures. And what does it do? Widens and mineralizes the cranial sutures. Cranial bones move the cerebrospinal fluid, remove plaque from the brain. They activate the pineal, produce melatonin, cools the pituitary for hormonal health. Helps to activate pituitary function. Pretty important, isn't it? What am I treating? Who is my patient? Everybody. There isn't anybody on the planet that can't benefit from this. So here we're saying the left side, this left side cranial system is working better, his right side not so much. And guess what? You don't even need an X-ray. You're going to know that in his nasal cavity, he's narrow on the right side. Now with him, the way he developed on the left side, chances are he's got a deviated septum to the right. Chances are he needs an ENT. Just by looking at him, he needs an ENT to treat his deviated septum. And just by knowing him. And guess what? When you look close, you can see the difference in the nostrils. All right, so did I use my time? 10 o'clock, yeah. So I don't want to mess with, I have a lot more, but I think I got you guys' juices going a bit. And so Tim is up at 10 o'clock, so I'm going to.
Well, thank you. I don't know how I match that passion, but I'll do my best. So if I am 81 and have that passion, I'm going to be thrilled. So thank you so much.